Hi, I am Lauren Kramer. I am a breast cancer survivor. I went through breast cancer while pregnant and I feel the need to give back. So today I am going to talk about chemotherapy. Truthfully, I just like to wing it, and that is what I'm doing today. So cheers to that. Tea makes me feel insanely cozy, and if you're not cozy, what are you? I kind of wanted to talk about my experience with chemotherapy really quick and talk about maybe what to expect and what my experience was to hopefully help you make it a little less overwhelming if you're heading into chemotherapy. For me, I did ACT chemo, I did adriamycin, Cytoxan, and Taxol chemo. There are 2 chemos, so it started off with AC. For me, I did 4 rounds of AC and I did it every 3 weeks. Because I was pregnant, I didn't do dose dense. Dose dense chemotherapy is when you do your infusions closer together and do things that help take medication that allows you to do that. Specifically for AC, I could have done dose dense where I did it every 2 weeks, possibly. In the middle of that, done a Neulasta or an injection that helps with your white blood cell count, because that's what takes a huge hit when you're going through chemotherapy. But because I was pregnant, I can't do that. I couldn't do that injection. So I did it every 3 weeks for 4 infusions. Then after that, I did 12 weekly Taxol treatments. I did have a break to have my daughter. I had 4 after I resumed chemotherapy, and then that was it. So here we are. What usually happens with chemotherapy? First and foremost, they need to have a way to gain access. So whether that be a port, I would suggest getting a port, or they can go intravenous, or they could even do a PICC line. Honestly, just having, I only have experience with a port, but if something happens to your port, they could always go to your arm. Like I said, if you can, I would suggest getting a port. I got my port because I was pregnant under only local anesthetic. I know a lot of patients are recommended to do twilight or even be fully asleep when this happens, and I would recommend that. It's totally doable even under local anesthetic, but it was a little overwhelming just because you're laying on the table, your face is kind of smushed, you hear people talking, they're pushing on you. It's just a lot and you just don't need it. So if you can, go to sleep. When you are going to chemo, they're always gonna have to access your port. So you always wanna wear something that's super easy to access your port. So my port's over here, I actually still have it. Let's see. You can see, mine sticks out a lot. You can see the 3 prongs and they put the needle in the center of that. That's my scar. And you can kind of see where it tracks. But anyway. See that? I just had to like pull. This I actually would wear to get my blood drawn, but I don't really care about this shirt. But there are shirts, if you want to wear a V-neck, always easy to pull aside. Sometimes there's shirts that have zippers here. If it's in the winter, you could unzip and just open it up, and then when they're done, you could zip it right back up. A lot of the times I dealt with, I was in the summer months, so I wore a lot of tank tops or sundresses and just brought a cami with me. Let's talk about first day of chemo. You're scheduled, you get a chair, you pick it out. I mean, every cancer treatment's different. Some have rooms, some have basically like lounge areas where you each kind of have like a section. Some are curtained off. Usually, even if there's an area that's pretty open, the facility usually has areas of privacy. A lot of the time, that is for patients who aren't physically able, or if it's open for anybody who asks for it. So if you feel like you need extra privacy, always ask for that and see if they have anything available for you. With chemotherapy, they always want to do blood work prior to your chemotherapy. Some centers will do it the day of chemo. Mine did it the day before, the day or 2 prior. So they check on your blood work to see kind of a baseline for before the first chemo. And they want to know where all your counts at. They do a CBC, CMP, who knows, maybe your doctor does more, but they want to see where you're at. So every time you have an infusion day, just know you also have blood work to do that day or whatever your cancer center wants you to do, whether it's that day or the day prior. You will always need blood work. And if you have a port, they could do all your blood work through the port, which you're still getting poked with a pin. It's a lot easier. You can numb your port, so that makes it a lot more tolerable for some people. So get your blood work done. That's all squared away. You go for your first chemo infusion. If you haven't had a nurse coordinator, or you haven't had a nurse educate you yet about everything that you're gonna be doing, they will educate you, or they should educate you before they infuse the medication. If you hadn't had education on the medications and the chemotherapy that you will be taking, ask for it. It's important. They need to go over what it is, what it's doing, why it's doing it, what it's going to do to you or potentially going to do to you, and if there's any contraindications, which means any medications that you shouldn't be taking. They should be going over all of this with you. So if nobody has done that, ask for it. A lot of chemotherapies also require weight checks prior to, so just expect them to check your weight typically before every infusion. As well as before chemotherapy actually happens, there's a lot of, something I didn't realize until I went to chemotherapy for the first time, is that there's a whole hour or so prior to your chemo that you're there getting pre-meds and fluids. They want you to be hydrated, and they also want to give you medications that help the side effects of chemotherapy. So something that I had for my treatment was because I was pregnant, there were some things that they changed, but what I did have was the ondansetron, which is Zofran, and that helps with nausea, and also I had steroids, and then I also had Benadryl. So the Benadryl, like, you could feel it hit, and there's something different about IV Benadryl, IV Bennies, and it really zens you out, and a lot of people will go to sleep. I couldn't do that. I'm just not the kind of person to sleep. Like, even as exhausted as I was after Benadryl, I just chilled. I wasn't able to fall asleep. But if you are the kind of person that really wants to sleep, bring something to cover your eyes, get cozy stuff. You could bring blankets. They have them. They usually can warm them for you. Ask for all the things and they will provide. And if they don't, bring it. Side note for cancer patients who are also pregnant, sit by a bathroom, because with all those fluids and medication and chemotherapy, you're gonna have to go to the bathroom. And if you have a baby in there, it's gonna be pushing on your bladder and you're gonna need to go to the bathroom. So that was something that I did, is I always asked for a chair or a space that was near a bathroom, so I didn't have to walk that far, because you do have to take your IV pole. So something else to expect, that the nurses will be suiting up to give you your chemotherapy. And sometimes that can be a little overwhelming, because you're just sitting there in your regular clothes, and all of a sudden this nurse is like, wait, I can't touch this med because I'm gonna be injecting it into you. So I'm gonna get all my PPE on just to inject you, and it's a little overwhelming. There also will be another nurse that typically checks off on these medications. If there's not, there should be, because it's an important drug and it's very toxic, obviously. So there should be another nurse or another staff, another medical professional signing off on these medications prior to the injection. And they should be confirming that it's yours, that it's you, that it's the right dose, all these fun things. I thought chemotherapy was gonna be like, my doctor did not tell me it wasn't gonna be 8 hours long. But for my AC portion of the chemo, the pre-meds was about an hour, and the infusion was about an hour. Sometimes the whole thing was about 2 hours, 2.5 hours. I'm kind of fuzzy on those details just because it's been a while and I think I blocked some of it out. The first one went by so fast for me because the nurse was educating me, we were chatting and getting to know each other. I didn't really have time. I thought I was gonna be reading all these books and like watching all these movies, and I didn't really have time for it. So you'll kind of see how it goes the first time. I brought a big backpack that I didn't need most of the stuff in it, but you'll figure out exactly what you need. If you're, for AC, I did not have any reactions in the infusion chair. Of course, I had side effects, fatigue, my blood work all was going in the tank. And I was just extremely exhausted, where napping wouldn't really fix that problem, or sleeping wouldn't really fix that problem. So side effects for AC, besides the progressive fatigue, because chemotherapy is progressive, meaning it builds upon one another. So you'll start off feeling great and it slowly starts to add. Constipation was something I didn't expect, where I had to prophylactically take Kaale prior to my chemo infusions. I was also pregnant, so just keep that in mind. I did have some mouth sores. I had to be very gentle. I had a really soft toothbrush that I needed to use over that course of my chemotherapy. My appetite totally changed for sure. And sleep wasn't always the best, because you do get steroids during your for your chemo, so it can affect your sleep. Big factor that I'm sure if you look up Adriamycin cytoxin, AC chemo, you will see the red devil. That is what it's called, because it's just evil. And it's red, it's this big red injection that they have to push slowly over I think it's about 10 minutes. I'll have to check back with you on that. I'll have to look it up, I forget, but it was slowly over time. While you're getting infused, if you go to the bathroom, you will notice your urine is bright red, and it's a little overwhelming. If you're pregnant,
they need to tell you this because you don't want to think you're bleeding. That is horrifying. But also, they do inform you that of toilet hygiene after you have chemotherapy. There are restrictions on what you could do because the chemotherapy is still in your system. So as long as your urine is still red, it's still in your system. And they recommend you cleaning your toilet and taking specific precaution they'll go over with you after your chemotherapy for I think about 2 days. For the second chemotherapy, Taxol, to be quite honest, I did feel like I got a little bit of reprieve with Taxol. Literally within 10 minutes, I did have a pretty severe reaction. Heart started to race, I couldn't breathe, my lips were like numb and tingly, pain in my back. Immediately, she shut off the infusion and I started to feel better slowly but surely. They gave me extra fluids, they gave me extra Benadryl, and then they restarted with obviously the doctor's approval at a slower rate. It can happen. There's always somebody, especially if it's a new medication, nurses will be watching you all like a hawk because it's a new medication and they do not want anything to happen to you. So it doesn't happen to everybody, but if it does, they have ways to handle it. Side effects for Taxol, I definitely was still tired, but my blood counts did start to recover a little bit, although my neutrophils were still going south. There was a point where I thought maybe we'd have to take a break from chemo for it, but we luckily didn't have to do that. I was able to, I definitely was tired. The days, obviously, post chemo, I would feel a little heavier, a little worn down, but it would recover quickly than it would from AC chemo for sure. Some experience with like peripheral neuropathy, which I didn't do the frozen gloves or the frozen feet. Those that I worked with were saying that there's not a lot of actual evidence that works. But I will say I didn't do it, and I'm dealing with neuropathy as we speak. Fingertips are numb, and I'm not sure if icing would have helped that, but I'm just gonna be the one to say it. I didn't do it, and I'm dealing with it. So take that as you will. Some things I would recommend taking with you. So what you should bring in your chemo bag. You don't need an enormous bag. If you want to bring, you could bring whatever you want. They literally won't care. You could bring a suitcase of all the things that you would like to bring. Hey, Riggy. You will find after your first infusion, you will kind of settle in and see kind of what they have there, what you want to bring, how you want to spend your time. For me, I'll just tell you kind of what I had in my bag. I alternated, so I have an Amazon little Fire tablet that my husband got me, and I also have a Chromebook, so I use those a lot. I usually brought both because sometimes I just wanted to like listen to a book, set up my laptop and watch Netflix while I was like chit-chatting with my friends on Facebook or on my Messenger. I brought books. I usually had all 3 of those because I didn't know how I was gonna feel that day. I always brought snacks that I wanted because they had coffee and snacks at the cancer center, but I always opted for something a little healthier like fruit or I don't know. There's just something that I had more preference to. So if you have a preference for what you want to eat during chemo, then take your own food. Get a tiny little cooler is all you need. You don't need anything excessive. Just think about how you want to occupy your time and distract yourself for a few hours. That's really all you need. If you're somebody that doesn't tolerate temperature well, wear layered clothing because you could always take stuff off, put it on. And bring a phone charger just in case. My cancer center actually did have a lot of aromatherapy products, so you could just ask for it. They might have, you might be surprised at what your cancer center offers for you. Always wore, because I was pregnant, I was always hot, it was summer, so I always wore flip-flops or some kind of sandal, but I brought socks with me at all times because you never know. So always just come prepared to make yourself the most comfortable that you can be. I forgot to mention, because I don't know why. Hair loss. So with Adriamycin Cytoxan, I lost my hair so I had my first chemo treatment. 2 weeks later, buzzed my hair. Gotta get my dog. So, again, dogs, how to get let in. I can't believe I just forgot, after saying all that, I forgot about my hair loss because that was a huge thing for me. That did happen with AC chemo. There is an option to try to preserve your hair using cold capping, essentially where it freezes your scalp and hopes to help preserve the hair follicles. It can retain some hair, a lot of your hair, or no hair at all, and it's very expensive. So I didn't really that wasn't something I wanted to do. I didn't want to add any more stress to my infusion days. So I was the person that wanted to wait and see what happened. So again, had my chemo infusion. About a week and a half later, I was starting to experience hair loss, where I would just pull and I would see like a pretty decent sized clumps come out, and eventually like I would literally touch my hair and like just a chunk would come out. My hairline started to recede. My first chemo infusion was May 13th of 2021, and I shaved my hair officially June 2nd of 2021. This is about, this is well over a year of hair growth. It's happening. I haven't cut it at all, so this is what it is. But so about hair loss, if you're a person that wants to rock a bald head, go for it. If you're unsure of how you're gonna feel, I definitely urge you to be prepared. Buy yourself a wig or beanies or things that'll make you look cute to put over your head, just so you have it just in case. I wasn't sure how I was gonna feel. I was very nervous and anxious, so I brought some head wraps or little beanies, and I bought a wig. I went to a wig shop and I kind of got fitted. The color was really great. Didn't really end up liking that wig. I bought wigs on Amazon and ended up liking those the best. But I didn't really wear them that often. So you have to find out what's right for you. Things that could be beneficial or supplemental to your chemotherapy, which I think that everybody should do if you have the time and if you have the energy. If you don't already, start therapy, start behavioral therapy. If you can, do acupuncture. Love acupuncture, and I swear by it. Do all the self-care things that you want to do. If you're able to muster up any energy, exercise, even just walking, these things can actually help with your chemo side effects. It is highly recommended that you don't have a sedentary lifestyle. You want to take care of yourself. There's a lot to cover with chemotherapy, so I think I'm just gonna leave it there. I hope you found this video somewhat helpful, and I hope you could find some information from it. If you are in chemotherapy or are going to start chemotherapy, just do your best to stay in the moment and stay as mindful as possible, and just know that you can do hard things. Be easy on yourself, be gentle on yourself, and do things that make you feel good. Celebrate those small wins, celebrate all the wins, and accept help. Now is the time to really just lean on those who are able to support you and that want to support you. Just 1 second at a time, and you got this. You might not want to be here, but you're here and you can do it. All right? All right. We end it. Thank you for watching, and I hope you have a great evening. I'll see you in the next one.